Hi, everybody. Lyndia Downie here from Pine Street Inn. I wanted to give you a brief update on where we started with this pandemic, where we are now, and where we're going next. But most of all, I want to say thank you. It has been the toughest time in my 30 odd years here at Pine Street, and we would have never have gotten through this without your support. I cannot tell you how grateful we are for it, and how grateful we are to you for staying with us, and literally holding us as we got to the other side of this. In early March, we started really hearing about cases of COVID 19 in Seattle, on the West Coast, where the virus hit first. And we did start to really do a number of things, including putting barriers between our beds and additional cleaning, putting plastic screens in front of the food services area. What we discovered in mid March is that about 1 in 6 of the homeless men and women we work with in our shelters were testing positive. We worked closely with our great partners, Healthcare for the Homeless, and we were able to get a hold of additional tests, and we did some universal testing. And that number basically doubled when we did universal testing. So we went from 1 in 6 to 1 in 3. I can't tell you the fear and anxiety that created among the guests and the staff. We have a lot of people here who are vulnerable, who have pre-existing conditions. Um, a third of the people that we work with are over 60. And all of those elements really made us so afraid for people. And when we did that universal testing, we had to very quickly find both isolation and quarantine sites for our guests. They couldn't stay in shelter at the risk of spreading the virus. People had been exposed, had to be quarantined, and it was a massive effort. And we could have not done it without your support. None of this was budgeted for, not the additional sites we were able to bring up, not the hazard pay for our staff. Not the cleaning, not all the physical and capital improvements we had to make to the shelters. Very grateful to Mayor Walsh and his staff who helped us secure dorm space at Suffolk University, and to the Davis companies who worked with the city to offer a building that's going to be redeveloped up on Commonwealth Ave. So we were quite quickly able to move about 350 people out of shelter into these other sites that had private rooms and a bathroom, and that proved to make all the difference in the world. And when we started this, our positive rate was 34%. As of about 2 weeks ago, we're now down to an average of 4%. What made the difference? The ability to move people out really quickly into other sites. The fact that those other sites had space where people could literally close the door and be by themselves. They had private bathrooms. We were able to support anybody in isolation or quarantine in those sites with the great work of our staff. But of course, we wouldn't have had the staff to do the work if we didn't have your support. So we have learned a lot through this, and there's a couple of things that I really do want to talk about going forward. The first thing I want to say is that housing and healthcare are linked. If this pandemic has proved anything, it's that if we expect people to be healthy, they have to have decent housing. And when I say decent housing, I'm literally talking about a room with a bathroom, nothing fancy, nothing big, but something that meets minimal standards for folks. The second thing I want to say, in this time of awareness around racial equity, we have a lot of work to do here at Pine Street. We have our own internal work to do, but we also know that homelessness disproportionately affects Black men and women more than other people. Black men in particular have a high rate of homelessness for lots of systemic reasons, and we need to recommit to housing and targeting that housing to people who have been impacted the most. We are going to renew our commitment to housing. We, I think, as some of you know, have been really marching on the road towards more housing and less shelter. We now need to get there faster. We need to get there in a much more creative way. We need to think about sites that traditionally we may not have thought about as housing, and we need your help. We need creative partners, and we need to get on it. The only thing that will end homelessness is housing, and the only thing that will prevent another outbreak of COVID 19 and other public health disasters is for people to have housing. And I will leave you really with a couple of things. One is that when we uh, when this pandemic started, we obviously reached out to all of our tenants. We have 850 tenants now. Um, we think about 10 people tested positive. Now, we did not do universal testing in housing the way we did in shelter, but one of those 10 folks ended up in the hospital. He's now back in his apartment and he's doing okay. Um, Everyone else we were able to support at home, just like you and I, if we got the virus, would have recuperated at home. We were able to hook people up with their primary care folks through telemedicine. We were able to go to the pharmacy for them. We were able to help them with food or grocery shopping, and they weathered it. I would contrast that with shelter, where we had hundreds of people who tested positive and who had to be put into isolation or quarantine sites at a huge both cost and huge infrastructure lift for the healthcare system. So you see why we're committed to housing. You see why housing matters. We have got to get there. We appreciate your support through this so far. If not for your support, our incredible and heroic staff could have not done what they did through this. And I want to thank them, but I want to thank you for supporting our staff, our tenants, our guests. Please stay with us as we update you on where we're going next. Thanks, everybody.